Dude, 1/3? That's insane. That's not sustainable at all. The problem with medicine and being a doctor, from Karma Medic, let's see what he has to say.
The parts of being a doctor that I really don't enjoy. If you don't know, my name is Nasser and I'm a doctor living and working in the UK, about 1.5 years into the job. Working as a doctor is about as far from providing a good work-life balance as I could have imagined. Let's start by talking about the total hours, which doesn't tell the whole story, but I think it's a good place to begin. In our junior doctor contract, we are contracted to work something like an average of 46 to 48 hours per week, but this changes quite a lot depending on the specialty that you're in. And I'll post a screenshot or an image of my schedule over here, which shows that I'm scheduled to work something like 52 hours in week 1, 72.5 hours in week 2, and then 42 hours in week 3. So as you can see, oftentimes you're scheduled to work a lot more than the contracted average hours that you're supposed to do, but that doesn't even account for all the hours that you spend coming in early to prepare the patients for your ward rounds before your seniors come into the hospital, or the hours that you stay late, because often we're understaffed, overworked, and there's a lot of outstanding urgent tasks that need to be done before you get home, so you often end up staying late to complete those as well.
So Europe versus the US, I think he's in the UK. Different systems. In the US, it's kind of messed up there. I mean, it's an 80-hour work week restriction on average, so there's weeks where you're going over. You need to average around 80. Sometimes specialties, especially surgical subspecialties, will push that, especially things like neurosurgery. The nice thing in Europe is that you are generally not working anywhere near that. I mean, even Ali Abdal, when he was a junior doctor, he said he was working like 50. 44 is the average that they assign, but then of course he's doing a bit more than that than he outlined. And it's not to say that because it's worse in the US that in the UK it's fine. It's just to show you that in all these various countries, like, medical trainees are working pretty hard. I do think they abuse the US trainees more, and the reasons why they can do that later in this video perhaps. But keep in mind, in the US, those 80 hours don't include the time you're spending prepping for next day's cases, prepping for whatever tests you have to do in residency, prepping for whatever presentations you have to give at the grand rounds that week for whatever research you guys are talking about, and so on.
But when you work as a doctor, you tend to work a lot of on-call shifts. So these are shifts that can be 12 hours, 13 hours long. You tend to work a lot of weekends, and you tend to work a lot of nights, especially as an SHO or a doctor after the first year, anything between F2 up until a registrar. Now, once you're kind of going with the schedule, you start to realize that you're spending a lot of time in the hospital during what we would refer to as unsocial hours. So these are hours after the traditional 9 to 5, or hours on the weekend or on nights. These are all times when you would otherwise be meeting up with your friends, you would be able to relax and kind of take a break away from work, but instead you find yourself back at the hospital. What this makes particularly difficult for me is having scheduled and regular activities in my life. So let's say I want to play basketball twice a week from 6 to 7 p.m. with all of my friends. One week I might be able to make that, but then the next week I'm working on call, so I'm working until 9 p.m. Or the next week I'm working on the weekend, so I can't attend that game. Or if it's my friend's birthday on the weekend, someone's, wedding or some big social gathering. If I'm working weekends or nights, it makes it infinitely harder for me to attend those events, or I just can't attend at all because I'm scheduled to work.
Super common in medicine. Essentially during your clinical years in med school in the US and during residency, recurring things in the evenings are, again, it kind of depends on your specialty. If you're like in primary care, family medicine, it's going to be more doable versus something like neurosurgery. But one point he brings up that's really important to elaborate on is the regularity of those hours. It is a lot easier to work 60 hours per week when you know the exact time you're going to start and end every single day. You have your routines, your wake and sleep times, everything dialed in, versus when it's irregular, but you're working 45 or 50 hours. Because of how our human bodies operate with our circadian rhythms, it's a lot more challenging to do the irregular versus the longer regular.
You have your weekend or your days off on random days during the week when all of your friends are at work. My friends are all at work during the week. They're less likely to want to hang out in the evening, and it just makes it harder to see them and harder for me to do activities that I want to do.
Dude, I was so antisocial in residency. I just grinded it out with residency, and then they work you 6 days per week, and then on the one Sunday or one Saturday that I would have, sometimes you're working both days, both Saturday and Sunday, but usually on average 1 day per week you'd have off. I was just catching up with Med School Insiders and Blue Link, the two companies I was working on at the time, and I like barely saw anyone. It was not sustainable, obviously.
Another thing about the schedule is that it's just completely different every single week. You know, one day I'll be working Monday to Friday, 9 to 5, and it's like, oh, a little bit of stability in my life. Let me go to the gym a few times a week. Let me go out for dinners, schedule time with my friends, etc. It just completely changes depending on the week, and it's constantly changing every week. I'm at the point where just before I sleep, I check my phone and see, what am I doing tomorrow? How many hours am I working? Where am I working? Because I might be on a different ward, in ED, in ambulatory care. So there's a lot of unpredictability and non-conformity or irregularity that comes along with the schedule.
So again, this is probably not going to be how his schedule is long-term. Junior doctor in the UK is kind of like MS4 intern year in the US. They don't have their dedicated specialty, they're jumping between different services, and where they're rotating is frequently changing. But at least in the US, we generally know for the next 2 weeks or the next 4 weeks, you're doing this service, right? And here it sounded like he has less regularity than that, doesn't even know until the day before.
I find working like this extremely tiring, particularly with the 12 and 13 hour shifts. So let's say I'm scheduled to be at the hospital from 8 in the morning until 8 at night or 9 at night. This means that by the time I wake up, get ready and go to work, finish work and then come back, I've barely got just enough time to eat something really quickly and get into bed and sleep. This is particularly true when I have a string of on-call shifts or a string of nights or a string of weekends when you're expected to be in the hospital for 13 hours a day. That's more than half the day that you're at a physical location away from your house. But obviously after working so long, you're really tired and you're exhausted and you need to relax, you need to unwind and reset before the next day. You know, I'm dealing with life or death situations throughout the day. I'm holding my on-call bleep. People have cardiac arrests and we need to resuscitate them. There's lots of really unwell patients, difficult family members, very difficult patients to deal with. It's a particularly emotional and stressful job, I think both mentally and physically. So by the time I get home, you know, all I can do is just sit down and try and unwind before starting the next day again.
I can totally relate to that, and what I found helpful was just creating rules for myself, which is that if I have the option, this is a rule that I use all the time. If I have the option of whether or not I should go to the gym, I already have my answer. I need to go to the gym. Because if I have the luxury of saying, oh, do I have time to go to the gym? It doesn't matter if I'm tired, doesn't matter, whatever. That means on the way back home, stop off at the gym, get an hour or 45-minute workout in, and then go home. Because once you go home, you're not gonna go out. And there's a lot of days when you work 16 hours in a row in surgery, and like obviously you can't, there's no option to go work out at that point.
And then this doesn't even touch on night shifts. Having to flip your schedule around from days to nights and being the only doctor responsible for something like 250, 300 patients is unbelievably stressful and comes with so much emotional and physical just pressure and stress that it's really hard to explain. In summary, the work schedule of a doctor is quite hard. The second big thing I want to talk about, stress and responsibility. Being a doctor can be extremely stressful. Seriously, there's a lot of stress associated with the job. The best example I can think of is that when you're in the hospital, you're sitting around on the ward and the crash alarm goes off. If you're unfamiliar, crash alarms are this loud, annoying sound which is meant to grab your attention and does a very good job of that, which is pulled or issued when someone is critically unwell and needs medical attention immediately. And you get this call either through a big alarm sounding on the ward if you're physically there, or through a small plastic device called a bleep that you carry on your person, and it alerts you to a cardiac arrest or crash.
We call it a pager.
So picture this, you're sitting at your desk, typing up your notes, and then suddenly this alarm goes off. And all you know is that someone is really unwell and could be dying, and you need to get there as soon as possible. Could you just imagine being in a typical office job and every now and again you get a little beep on your phone that tells you someone is about to die or is on the verge of dying. You have to rush over there and quickly assess the situation, you know, save this patient if they are really unwell. It's just an incredibly alarming thing that happens on a regular basis for all the doctors who are working.
And again, that's going to depend on your specialty. And I think Nasir did a great job of saying that, hey, you know, there are challenging things about finance and these other careers. For those who are younger and are deciding what career is going to give them that upper middle class lifestyle, keep in mind that every single option is going to have its own stresses, its own downsides, its own costs associated with it. And you need to decide which one has the upside and the downside, that combination that you're okay with. It's really easy to focus on the upside of all of them. Which one makes you feel like it has a really big upside, and which one has a downside that you can tolerate as a cost for that big upside?
It's hard to describe the stress that runs through my body when I hear this alarm go off. I'm comfortable and I'm competent in going to these situations and assessing the situation, but even so, it's still stressful. And of course, there are a lot of situations which are particularly difficult to deal with that require lots of people. And sometimes that help isn't always there immediately, and it can be really difficult to manage.
So keep in mind that depending on your specialty, you may or may not deal with this frequently. So if you don't like dealing with it, you can choose specialties that have fewer emergencies like this. But if you like the excitement, you like that adrenaline, then there are specialties that give you a lot of it.
This is particularly true when you're working on call out of hours or on the weekend or on nights when there's just significantly less staff around, especially on nights when I'm the only doctor covering 250, 300 patients. I've had 2 recent night shifts that have just completely shifted my experience and understanding of what it means to be a doctor. First one was in my previous hospital when I was dealing with just a particularly unwell patient who was requiring all of my mental and physical energy, both of my hands, to carry out all of the activities in front of me. And then a nurse came up to me actually and told me about a patient experiencing chest pain with ECG changes, which is significant for something like a heart attack. And then whilst I was trying to manage that situation, a patient fell and hit their head and was bleeding. And I was the only doctor around and the only person who knew about these 3 things. And having to, appropriately escalate these different patients and come up with a prioritization and treatment and management plan for all of them was unbelievably stressful.
These are people's lives that are in your hands, and the fact that he's the only one there for 250 patients sounds like they're seriously understaffed at that hospital. That's a problem.
I remember just being in the office on that ward, looking at my piece of paper where I had written down all these different patients and what was going on with them, and I almost burst out into tears. I've cried a handful of times in my life, maybe 4 or 5, and I almost lost it. I was thinking to myself, what am I supposed to do here? These are 5 really unwell patients who all need my attention and all need my help. How am I supposed to deal with this situation? It can be very, very tough to deal with. Now, just to clarify, there is a senior available somewhere in the hospital and you can always call, but that doesn't change the fact that you are the person who's there and you are primarily responsible for what's going on, and you need to make the decisions about where to go from here. So although you can call for help, you can call for advice, things take time. It's not quite like the movies where you say, give me a stat dose of this, or it's really not like that in real life. Things take a lot of time. The level of responsibility that we hold is just absolutely huge. It's really hard for someone who's not in healthcare or not in the medical field to kind of understand and appreciate that. I think the knowledge of the general public about how hospitals run and how things work within a hospital is very, very different to the reality.
Oh yeah, I think that's probably really widespread just because of how TV shows, the media overall, portray doctors and life in the hospital.
Don't worry, it doesn't hurt.
If you think that doctors are the only people who are stressed in the hospital, you'd be very, very mistaken. Of course, patients are going to be stressed, their family members are going to be stressed, and every other member of staff is going to be stressed. Everyone from nurses to physiotherapists, occupational therapists, radiographers, everyone is constantly stressed.
Yeah, a lot of the hospital staff is spread thin. Like, my girlfriend is a nurse, and the understaffing issues and the unsafe practices are pretty wild.
Given how much you're talking to people who are new to you, you spend a lot of time managing the stress, the anger, the frustration that oftentimes comes along with talking to these people, which can be extremely, extremely stressful and takes quite a significant toll emotionally. What I particularly dislike is having these conversations and negative emotions and stress from other healthcare colleagues. From patients and family members, I can understand. They're in a foreign environment, they're probably in a very unhappy or dark place in their life. But when doctors and healthcare staff speak to each other in anything but a non-polite and respectful way, it really gets under my nerves. I like to think that I talk to everyone in my day-to-day interactions in and out of the hospital with the utmost respect and kindness and whatever.
Yeah, it definitely gets under your skin. Don't be negative. No one likes to work with someone who's negative and brings them down. And you'll find certain doctors or certain healthcare workers that are just super disrespectful to other people because they think they can get away with it. Don't be that person, because karma comes around.
And I just find it incredibly strange that we don't give each other the maximum amount of kindness, niceness, and respect, particularly when talking on the phone. This obviously differs from hospital to hospital and department to department that you work at, but sometimes I would be calling particular specialties, namely cardiology and resp. I think we're two of them. Radiologist as well.
I guess the stereotypes are true across the pond too, huh?
And just the amount of sarcasm and rudeness and sass that you might get on the phone, or just, flat out insults about why you don't know X, Y, or Z, was just unbelievable to me. I couldn't imagine speaking to anyone like that, period, let alone my colleagues in the hospital. But this really just comes from a root of everyone being at such a high baseline level of stress.
Yeah, for the most part, some people are just miserable. And I think that you'll see a much higher percentage of that. At least I did when I was MS3, MS4, the first times I'm picking up the phone, and the person on the other line, they can see that I'm a trainee, I'm like newer, I don't have as much knowledge as the senior, and they probably feel like, dude, like, I'm sure on time, like, just give me the senior, was what they're probably thinking, and they're getting frustrated. So those occurrences should hopefully decrease with time, but it's sad that they occur in the first place, right? We should be excited to train and support our future physicians.
The next cohort of people that are under stress and can be difficult to manage or talk to are patients. So patients are understandably, not feeling well, stressed, probably scared, and just unsure about what is happening to them and maybe what their future, sometimes you have patients who are being particularly rude or who are very stressed and, shouting or angry or talking in a very unpleasant way. And you kind of have to suppress all of that and keep your sense of calmity and zen to be able to do your job and treat these people and help them.
It can be really tough because certain patients, they will really try you, but you have to be professional. You're ultimately in a professional role in a professional setting when you're working as a doctor. And it's going to be tough. It's going to test your patience, but it gets easier with time. And venting about it a little bit with your coworkers can also help take the edge off.
And that's not to say all patients are like this. In fact, from my experience, I think that's absolutely not true. And so many patients are unbelievably kind and nice and really express their gratitude and thanks for everything that, is being done for them in the hospital.
Yeah, because most people are decent human beings and most patients are going to be very grateful.
And I always let them know that I really, really appreciate that, because when they do, it's a very nice reminder of what we're doing here is actually meaningful and making a true impact on the people in front of us. But that doesn't mean that you don't deal with a lot of very difficult patients as well.
And again, this comes back to specialty choice, because certain specialties, let's say psychiatry or emergency medicine and certain subspecialties within IM and whatever, are going to have a higher percentage of difficult patients. So if that's a high cost item to you, going back to that, pros versus cons, the upside versus downside, then choose a different specialty that has a fewer number of difficult patients. Things like dermatology or infectious disease or rheumatology.
One of kind of the big topics that comes up over and over again is conversations about DNA CPR or end-of-life decisions. DNA CPR stands for Do Not Attempt Cardiopulmonary Resuscitation.
Yeah, in America we say DNR, Do Not Resuscitate.
If a patient's heart or lungs stop functioning, we are not going to attempt to restart them. Restarting them typically involves what you will have seen in the movies, which is jumping up and down on someone's chest, delivering electric shocks, and some very powerful, strong medications that can sometimes help restart a patient's heart. Performing CPR and doing this resuscitation process is absolutely nothing like it is in the movies. Delivering CPR or cardiopulmonary resuscitation is a treatment in itself, and it's a very traumatic and harm-causing and harm-inducing treatment.
Broken bones.
We, as medical staff, do not offer this treatment to people who we think will not benefit from it, or if they do survive, will have a poor quality of life after treatment.
Very poor mask fitment in that B-roll.
So if you do survive CPR, you need to go to ITU or HDU. And a lot of the time, the kind of clash between the medical professionals and the patients or their family about this topic is a lack of understanding of what CPR actually involves. What percentage of people actually survive something like CPR. We end up having a lot of quite difficult discussions around this topic, which is obviously quite sensitive, quite emotional. People feel very strongly about these things.
Large gap between public perception and reality, and as healthcare providers, it's our job, our responsibility to educate the public. So great stuff he's talking about here.
Particularly in my first year working as a doctor, I would have nights where I would wake up in the middle of the night and think to myself, did I do this properly? Or did I explain that correctly? Or should I have said this? Or should I have said that? And that's never a nice feeling to have. And my rule of thumb is just do the best possible job you can do when you're at the hospital, so that when you leave, you don't have any regrets, you don't have any questions in your mind, you're not unsure of anything.
I respect that a lot. To be the kind of person that is reflecting on those things, I can relate, and I think that it indicates that you care, right? And that you want to do the best job that you can. And generally it means that by being so reflective, you're going to improve at a fast pace and provide great care, and you're taking things seriously. I think that's really admirable.
Because there's nothing worse than coming home and thinking to yourself, should I have done this? Should I have done that? Medicine is such a broad and wide field, and there's a lot that you can do and there's a lot that you can't do. Sometimes not giving treatment is the correct thing to do, and it's a very difficult decision to make and a very difficult conversation to be had.
Yeah, and I think what helps there too is talking to your seniors, talking to your colleagues about those conversations you're having in your head about what should I have done? Is this right? Is this wrong? It's gonna help you learn. It's gonna give you some perspective. It's gonna help you realize that, certain things are just challenging, and when you have bad outcomes, it's not always your fault. It's just kind of the limitations of modern medicine at times. So careful balance, because you want to be improving, you want to care, but you don't want to really sacrifice your mental health in the process.
Let's talk about pay. There's no way I could make this video without talking about pay. So in the UK, after medical school, doctors enter what's called the foundation program, which consists of 2 years, foundation year 1 and foundation year 2. A foundation year 1's starting salary is £14 per hour. This works out to about £29,000 per year if you're working 40-hour work weeks. You do not work 40 hours a week, you work more than that. And so your average yearly salary coming out of medical school is somewhere between £29,000 and £33,000. The median average salary in the UK is £33,000. The average job in the UK will give you a better salary than being a doctor. With the current cost of living crisis in the UK and inflation being out of control, the pay of public sector employees has to rise with that. It's an absolute joke that our pay has remained the same for the last decade. The salary has not increased with inflation at all, which is just nuts. On top of that, studying medicine takes a much longer time than a lot of other degrees. Here in the UK, medicine is a 5 or 6 year program. Now, personally, I think the fact that some of the brightest, most studious, disciplined, motivated minds in the country are given the same or slightly above average national UK salary is absolutely disgraceful.
That's really low. In the US, as a resident, you're making, like, every year with inflation, it goes up a little bit. So you're not making great money, but you're still making a lot more than that. In the US, I think starting as an intern right now, I don't know the current rates, but 55-ish K per year is where you're starting. Now, there's two sides to this. One side is like, hey, we've trained so much, we're providing so much value, and in the US at least, there's a lot of government subsidy to these hospitals to pay for the trainees' wages. So it seems ridiculous to be paid so low. But then on the other hand, it's like, well, this is all part of your training, and once you're an attending, then you're making the big bucks. Bucks. I like big butts, I cannot lie. The bigger issue I have, in the US at least, is that residents are used as cheap labor in the hospital and not as an opportunity to really improve their education, their training, and make them the best possible attendings. And if it was, I think right now, residents should be paid more. But if we focused on their education and not overworking them 80 hours a week as cheap labor, then I would understand the arguments more about, okay, hey, we don't have to raise their wages as much. But in the UK, it's not like they're making really low amounts as trainees. And I think even when they're done, when they're consultants, I think is the equivalent of attendings, they still make a lot less than in the US.
Healthcare professionals around doctors are being paid higher salaries than doctors. So what I mean by this are medically associated professionals, I think they're called, things like physician's associates or physician's assistants. Just look at this advert that I'm gonna post somewhere here on screen for a physician's assistant job with a salary of £31,000 straight out of school.
Dude, I remember this happens in the US too. It's like, the NPs and the PAs who aren't as well trained as even the resident physician, starting out make so much more, and then they work fewer hours per week. And yeah, it's really imbalanced here in the US too. It's very frustrating. And it looks like the same thing happens in the UK.
It's not that I think PAs don't deserve this salary. I think PAs absolutely do deserve this salary. I just think for the work that doctors do, we deserve to be paid more. The literal title of the job is physician's assistant, or in the best case scenario, physician's associate. The entire job is to assist the physician that you work with. How can you be paid the same or worse?
Yeah. Even in the US, very similar thing happens here where the physicians, sure, they're residents, but the amount of work they're doing, the level of training, the level of competence compared to the freshly minted mid-level, and the pay difference doesn't really make sense. And then you ask, okay, where does that money come from? Well, first of all, the hospital is getting a lot of cheap labor because of the subsidies from the government, again, in the US. And then there's been so much administrative bloat over the years. Do we really need that level of administrative bloat in these hospitals?
PAs or physician's assistants or associates don't work on call. They don't work in the evenings, they don't work weekends, and they don't work nights. They're not responsible for carrying a bleep to deal with those life-threatening emergency situations that we talked about before. They don't have the ultimate responsibility for caring for the patient because that always falls on the doctor. They're not able to prescribe medication. They're not able to request scans with ionizing radiation. These are things that only doctors can do. And yet our salaries are the same, if not less. Make this make sense. But we don't do the same job. We don't carry the same responsibility and we don't have the same set of skills. And to equate them or make them the same and use PAs to replace doctors in SHO rota gaps is absolutely insane.
Dude, I didn't realize that mid-level scope creep was such a big issue overseas as well. Wow, happening everywhere.
Putting someone who's not a doctor in the position of a doctor to diagnose and treat patients is just ludicrous. And to then pay them more than the doctors who are supposed to be doing that job is really, really demoralizing.
And the reason why they do this, hospitals, is because using a mid-level is gonna be a lot cheaper than using the consultant, the attending physician. And the junior doctor or the resident is working underneath that attending physician, but hospitals are looking at their overall costs. And that's why a lot of the lobbying for increased scope of practice, despite concerns of patient safety, they're progressing because of that cash, that moolah.
The pay for UK doctors is abysmal compared to other first world country standards. We've got Australia far, far ahead, and then Canada and the US light years ahead with significantly massive pay bumps in comparison to that of the UK. It's like a joke in the medical fields across the world about how badly doctors are paid in the UK. I'm currently working as an F2 doctor. After F2, I'm going to start surgical training. That'll be core surgical training 1 and 2, and then I'll become a registrar and do ST or specialty training 3, 4, 5, 6, 7, and 8. And then after that, I will become a consultant, which is the equivalent of an attending in the US, which takes 4 years from after finishing medical school.
Well, not really. You're talking about a surgical, that's not a fair comparison. He's talking about something surgical that he's going into, and then he says 4 years in the US to become an attending. General surgery, 5 years. Plastic surgery, 6 years. Neurosurgery, 7 years. And then we do 4 years college, 4 years med school. You guys go 6 years of like med school directly after high school. So not really a fair comparison.
When I am a consultant in 9 years from now, bear in mind I finished medical school last year and a half, and I studied for 9 years before that. In 9 years from now...
Still don't fully agree with this comparison. They do these first 2 years of junior doctor. We'll do, I think we already have a comparison of the UK, US, Canadian training systems here. And if not, then on Med School Insiders, we will do a comparison between the different training paths across the world.
When I become a consultant, if I take the fastest possible path to get there, in 9 years from now, I would earn £88,000 per year. This is an absolute disgrace.
Their attending salaries are way lower than in the US. And that's why you see a lot of people wanting to come to the US to be attending physicians here from other countries. You don't see the same of attending physicians here trying to go to other countries as much. 88K as a starting salary for a consultant, our version of attending, that's pretty low. But I guess one thing to keep in mind that I don't think justifies it, by the way, but one thing that does make it a little bit less outrageous, still outrageous, is that I think their average loan burden when they graduate med school is way lower by like an order of magnitude. But again, I'm not from the UK, so if I'm incorrect, someone please correct me in the comments.
Have a look at this table of my salary over the next 8 to 9 years before I become a consultant. I'm currently in F2. The average salary, depending on the jobs you work, is £34,000. Then it's going to go to 40, 51, then back down to 40.
Actually, when you convert the early years are very low, but when you convert the later years, like 50 to 58K from pounds to US dollars, it's actually not that different, interestingly.
How are you meant to raise a family on this salary? How are you meant to enjoy life and have disposable income to spend on entertainment and fun whilst also saving for your future on this salary?
Yeah, that's a lot tougher in the UK because in the US, sure, during training years, after the first 2, I think the pay comparison is not super different. But what we have to look forward to is the fact that as attendings, we're making multiple times more than what they're making, which then at least makes up for the lack of being able to invest, being able to pay down your loans. We do have massive loans on average. One thing you'll see around the world is that because so many people want to become physicians, it's a pretty desirable thing in most countries. They're able to get away with not treating physicians as well as they should, or even medical trainees. And as things get worse and worse for medical trainees and physicians, there's gonna be a tipping point where the societal narrative around being a physician catches up to the reality where it's, oh, hey, right now maybe we think it's better than it is. Eventually they're gonna get closer and closer, and then fewer people are gonna wanna go into medicine. And is the quality of our physicians gonna drop? Food for thought.
This makes no sense to me. All of our colleagues who studied in finance, banking, investment, computer science, we've got friends doing everything, and they all earn more than this, and they work in office jobs.
Yeah, it's pretty surprising how little they make once they're fully trained. And in the US, that at least offsets it quite a bit, whereas in the UK, wow, that's It's pretty messed up.
And you know, there's always going to be people who say being a doctor is a vocation. Being a doctor is something you do for other people. It's not about the money, etc., etc. Yes, a lot of what we do is for other people, and that's why we love the job, and that's why we got into this job to begin with. But we also need to be paid appropriately. We need to be rewarded for that stress and that effort that we put in.
Yeah, those who keep touting like
becoming a physician is just a calling. If you care about the money at all, I would do it for free.
it's like, dude, you wouldn't do it for free. Get your head out of your ass. Those who tout, hey, it's a calling and you shouldn't complain about anything and just be grateful. It's just a way to treat physicians worse and get more out of them and pad the pockets of the PE firms and the hospital administrators and the investors and yada, yada, yada. It's a nonsense take when people say that. So kudos to Nasir for coming out and speaking the truth.
Personally, from my own cohort of students that I went to medical school with, a very significant amount of them are no longer working in medicine or are planning to leave as soon as they can or move to another country to practice medicine elsewhere. And I don't blame them one bit. Look at this article in the BMJ. That was a survey done back in 2022. They found that 1/3 of UK doctors are planning to leave and work in another country within the next 12 months.
Dude, 1/3?
Can you imagine losing 1/3 of your country's doctors?
That's insane.
And the UK government is doing an absolutely horrible job of fixing this problem. What they're doing is bringing in doctors from abroad who are happy and willing to work in this pay and conditions only because their relative respective pay and conditions back home where they've come from is even worse.
And that's just not sustainable for the country. You're training all these doctors and 1/3 of them leave. That's not sustainable at all.
And what they're trying to do is make receptionists at GPs triage patient calls that come in through the front door. They're trying to make pharmacists able to do clinical and physical exams so they can then prescribe medications. They're trying to use PAs and HCPs to try and fill in the gaps and roles of doctors because of the understaffing and the poor rota staffing. So they're just trying to fill the gaps with people who are not doctors and making them do the doctor's job, despite having nowhere near the same level of training, clinical knowledge, or experience.
It's wild. This shit's happening all across the world. Wild.
Instead of doing the one thing that they actually need to do, which is retain their existing doctor population, they need to make better work environments for them and pay them better so that they're happy and willing to stay instead of leaving in large numbers. They need to increase the number of spaces available for those doctors, not increase medical student numbers at the beginning of this entire process. And I haven't even touched on, comparing our industry to others where people in equivalent number of years after university will be making so much more money. Those studying, finance, investment banking, computer science, they leave university and make 80 to 100,000 pounds plus is their first job out of university, with significantly less time spent in school, in education and training, etc. And in my opinion, a significantly less emotional and physically stressful job. On top of course, all of the perks that come along with working for a big private corporation, things like healthcare insurance, dental insurance, annual retreats, corporate away days.
Really important stuff. And a lot of people, they're just like, oh, the pay doesn't matter. Like, it's just the calling. And those are usually younger people that don't have experience, or they're people that are just trying to virtue signal hella hard to be like, oh, I don't care about money. I'm above that. And it's like, you put in the hard work and the effort, you want to be compensated fairly. You want your effort, your work, your value to be reflected. And it's still wild to me they get paid so little, less than 100K British pounds in the UK after becoming fully trained consultants. That's wild.
I work as a doctor because I love this job and I genuinely cannot wait to be a surgeon and the best possible surgeon that I can be, and I will be that surgeon. It just might take many, many years from now. I just want to be adequately paid for the work that I do. But I think it's really important that we talk about these things as doctors. Knowing these realities of the job and preparing for them socially, emotionally, financially, etc. I think it's really, really important. We love our jobs. We genuinely enjoy what we do and we get a lot of personal satisfaction. It's just the surrounding factors around the medicine part make things really difficult sometimes. And that's what I wanted to share in this video so that people were aware of these surrounding factors that can make the existing very lovely and beautiful job very, very difficult.
Great video from Nasir talking about a lot of important things, good takes on all of them. And glad we have people like him talking about these important issues because we do need change in the US and the UK, around the world. So let me know, did I get anything wrong? Do you disagree with anything? Comment below. Much love, my friends. See you in the next one.